Welcome. Here we have Nicholas, who's 21 years old, suffering from back and neck issues. How long has that been going on for, Nick?
Around 4 weeks.
4 weeks. And have you had any previous issues prior to that?
Yeah, I've had back pain before, but this has been the worst one that I've had.
Okay. And what sort of pain are you getting with your lower back and neck?
Every time I sort of like bend over or lie down, I get sharp pain on the left side of my back.
Right. And with your neck, what's happening with that as well?
Same sort of thing. Like when I turn it a certain way, it just feels locked.
Which way can you turn? Which way can't you turn?
So turning to the right is harder than turning to the left.
It's much easier. Yeah. Yes, I can see that. Has that given you problems? Is it quite bad when you're sitting?
It's not too bad when I'm sitting, but like if I look down, because I look down a lot for work, when I look down a lot, I start to feel the strain on my neck and my back as well.
And how long do you spend sitting down a day?
A few hours.
2 hours?
Yeah.
Gaming?
Yeah, a mixture of things.
Yeah, these young guys these days, all their problems due to gaming. Anyway, we're going to assess Nicholas today with his back issues, and then we're going to show you the quickest and most effective way of treating Nicholas's problems. What I've done here is basically with Nicholas's spinal problem, I've actually used a marker to outline his spine. As you can see with Nicholas, he's got a major rotation through the thoracics here. He's also got an increased lordosis, which is not good, and kyphosis basically up through the mid-thoracics. And that's giving him a tech neck as well, so his neck is actually going forward. Nicholas to bend forward, that should enhance the rotation through the thoracics, and we can actually ascertain whether he's got a scoliosis. So you can see the increased lordosis through the lumbars, the kyphosis. It's very important that you just don't treat the rotations and the lateral side bend that's occurring as far as his spine is concerned. It's also, what's really important is the amount of pressure and load that's happening in the lower lumbars, thoracolumbar, mid-thoracics, CT junction, and basically the occipital area. All these three areas are major fulcrum points or loading points. So they're the things that we're going to look at. We're going to reduce those. If you don't treat these flexions with the increased lordosis and kyphosis, then basically he's not going to get much relief. This is now made it to the bench, and we can see here, you can see the difference in the rotation. I mean, that's probably a good 30 degrees he's got there, as you can see through the lumbars and then through the thoracics as he goes down. He's really rotated. You can see the shortening and the thickening, and he's quite tender there, right through that paraspinal muscles. Okay, all the erector spinae group's really quite tender on him. This side, absolutely nothing. So you know the left side here is quite firing up, and that whole fascia is just really quite bad through there. So I'm not going to bore you too much with this. What I am going to do is I'm going to release this quite gently using BLT, because we want to get deep into the fascia and release that, unwind that first before we correct the back. On that left side, if I touch that thoracolumbar, look, he's quite wincing, he's lifting himself up. It's really quite tender, isn't it, Nick?
Yeah.
Okay, tell me how this is going to feel after I do a BLT release. What I'm actually doing here is actually feeling the movement of the tissues and the fascia underneath my fingers during his primary respiratory cycle, and I'm basically just going with it, and then I'm just allowing that body to unwind, and that's easing off already. How's that, Nicholas?
Yeah, it's softer.
Your treatments don't have to be, excessively long. You don't have to work quite hard. This is what I'm trying to show you with what I'm doing here, is that you can limit your treatments to 15-20 minutes. If you know exactly what you're doing, how you're going to manage this problem, it's quite easily to unwind the body and get it back into equilibrium. Equilibrium means that we're trying to get the body in the point where the tension is taken off the joints, ligaments and nerves. By doing that, it gives the body a favourable chance of healing itself. And that's eased off as well. How's that, Nick? Yeah, it's better. So already he's feeling quite better. I'm not doing the right side, I'm not balancing the right side. Don't need to balance the right side because it's a left-sided fascial strain. And look at that, that's quite soft now. How's that feeling, Nick? Yes. And I'm pushing really quite hard. He's not even wincing. Okay. All right, so what we're going to do now, we're going to correct this left-sided problem. He's got a left rotation at L5 with side bending, L3, thoracolumbar side bending right, rotated left. And as we go through the lower mid-thoracics, he's got a type 2 lesion at around about T7A, type 2 and a type 1 curve. That's what we're after. And then we're going to get one around about T3-4. Nicholas in a lateral recumbent position. We're going to do an L5. It's side bending left, rotated left. It's a type 2 lesion. It's also quite extended there. So I'm going to line him up and do a correction on that L5 first. So we're going to get this in the sagittal planes. So the sagittal plane is basically almost at a 45-degree angle. It's the line of the facets, and that's shifted there. Okay, L3 is what I find in the lumbars. It's right on the apices. So with L3, because it's so deviated and it's rotated, I'm going to use a rotation technique. So I'm going to correct L3 back to the right because it's going left. So I'm just going to just take him over and across, and there we go. It's got a massive side bending there happening in the thoracolumbar. So I'm going to try and do a side bending technique all the way up to thoracolumbar. These aren't really easy, quite easy to do. They're quite difficult actually. You just got to get the lock up the lower lumbars, and then basically put your force in through TL or T12. These are very effective to do if you can get them. I'm going to give it a go. Deep breath, Nick, and out. There we go. The second time round, we've got a good side bending correction on that. Now we're going to go through the thoracics. He's got a left major rotation. We said one's at T7, another one at T3. So the major loading point is T7, where he's really quite flexing. And put my hand straight under where that T7 is. Deep breath, Nick, and out. And then the other one's at T3, deep breath, and out. I'm going to treat the cervicals. We've corrected the lumbars, thoracics, and he's having trouble turning to the left. Is that right, Nick? Yeah. Yeah. So we're going to go to the CT junction because that's where the transitional joints change from basically going from a coronal plane to more of a horizontal. So there's always inherent weakness there. So I can feel he's going right, side bend right. We're going to just do a nice little side bending. And there we go. Correct it there. And then we're going to look at the rotation. He's rotating right there. As we go left, he's only got about 45 degrees of rotation to the left. He's got 90 degrees to the right, 45 to the left. He's got a problem just around about C4. I'm going to correct that back that way. And he's got 90 degrees. The OA which is quite tender, it's side bend left, rotated right, and that's contributing to his right rotation. So he's quite jammed up in the OA on that right hand side. So we're just going to go back, correcting this way, and that's corrected. And how's that now, Nick?
Yeah, a little better.
Good. And then we're going to just turn. Turns quite easily. As you can see, we've corrected some of Nicholas's problems there. He's got less rotation through here. Still has a little bit of lordosis. We're going to address that through the scoliosis because the scoliosis is shortening. You can see the left rotation through the thoracics is a lot easier. It's decreased. There's no pain there. And you can see the rotation now compared to before. I can put my fingers in there. There's not much difference there now as far as he had about 30 degrees on that. Probably reduced it by about 50%. And there's no tenderness there. How does that feel, Nicholas?
Yeah, a lot better.
Okay, if we're getting to bend over forward, you should be able to go a lot further forward. So improve his function, even the rotation through the thoracics and lumbars isn't as great or accentuated. We're going to check his scoliosis. Now, scoliosis play a really big important role. It's good to treat the spine, but also you got to look at the scoliosis and how it accentuates the lordosis in his back. If we bring Nicholas's both knees to his chest, let's just test his scoliosis. It's really quite tight. Grab the both knees, Nick. Okay, we're going to drop one. And look at that. That's absolutely terrible. That's what actually happens when you sit down all the time. All right, then let's go the other, hold it nice and tight, and the same. So he's got bilateral shortening of those soluses. There's two ways I can treat this. I can use a direct technique on these soluses and use direct inhibition release, or I can do counter strain, which I'm holding the legs up and using inhibition release, or I can use biodynamics. It's more impressive if I use some biodynamics from the head and we'll release that going forward. Would you like to see that?
Yeah.
Okay, just hold the legs down here. So I'm just going to link in. I mean, when we're looking at this and releasing it up through the skull, I'm actually linking into his body system and linking into his soluses as well through the primary respiratory mechanism that's occurring in the body. That's the inherent movement of the body during respiration, irrespective of his diaphragmatic breathing. I tend to use this, and when you do this, or basically use a reciprocal inhibition or even a counter strain, I mean, you're not going to get the soluses to release totally anyway, but they will improve, whichever method you want to use. I tend to want to use this only because people haven't seen it done before, and to prove that it does work really quite well if it's done effectively. So we're just going to sit here. It's going to take probably about 5 minutes for these to release, or for me to release them anyway. Might take longer, but I'm actually going through both anterior fascia, deep fascia, and it's not just so much the soluses, but it's also the anterior fascia through the chest wall cavity, down through the internal obliques, and then into the soluses. I'm basically releasing all that. And that's going to help him through the thoracics, help his breathing, help the function, overall function, because he's got like what we call an anterior drag through that anterior fascia, especially the deep fascia. And you'll probably find that his quads will be quite tight as well. So I'm just picking up the soluses now. I just released a lot of the thoracic anterior fascia. And we're going into the soles and down both quads. I'm going to get Jeremy to have a look at his quads and touch them at the moment, because they'll still be quite tight. Jeremy's going to just have a feel with each. You can see how much he's wincing. What do they feel like, Nick?
Rocks.
Rocks. Okay, so it's all that proves the anterior fascia. Let's check the left one, Jeremy. Not so bad on the left.
It's fine.
Yeah, so we're picking up more right, and right soles was a lot tighter as well. So we're going to go back to that in a minute. How does that feel to you, Jeremy, like compared to right with left?
A lot less tension on Nick's part, like the fibers don't feel as tight. A lot softer than the right hand side. So.
Right. So if you had to put that on the scale of tightness and 10 being tight, right compared to left, what would you say the right one would be?
I'd say out of 10, probably the right side would be maybe a 7 or 8 out of 10.
7 out of your experience, you felt?
Yeah, well, and then the left hand side, I would say, is probably about a 2.
Nicholas, with your pain level, if you look at do a pain score as far as palpation is concerned, what would you say out of 10, right being compared to left, pain-wise on palpation?
Yeah, the right side was definitely around an 8.
An 8, so 7 and 8, it correlates.
Yeah. And the other one was, I didn't feel it at all, it just felt normal.
Okay. Jeremy, I want you to feel that quad now.
Yeah.
ITB. How does that feel now, Nick?
Yeah, it feels like the other leg doesn't.
Does it feel sore now?
It's fine now, yeah.
How about you, Jeremy?
Yeah, it's probably, no, it feels the same.
And I've just got him into neutral. So that's all released. Let's just check the soles now. Oh, it was probably about, I'd say it was a good 15 centimetres off the bench. Mm-hmm. Let's go left. There you go. It's flat as. Let's go right. If you found the stand, look at that. And that's holding it in further. So he's actually touching, before his leg wasn't even touched on the bench. That is a really good result, just using the biodynamics. If we want to go further, we can do a P&F type stretch. Before, he would have been in pain. There's no way he wouldn't push his leg down. Now we can push it down. I'll get him to push up. Count to 4, relax, push up, and relax. And you can see now it's totally flat. So easy. Treatments don't have to be quite difficult to do. I could have done this whole treatment in 15 minutes. Push up there for me. And it's not so much the treatment, it's the management as well of Nicholas's problem. By doing that, you're setting your body in motion, we're getting rid of the dysfunction. We're getting him back into neutral, where his body's able then to cope under the stresses of life and load, especially when he's sitting up. His spine, it's much more in equilibrium, less rotation. On the first treatment, that's great. If we give Nicholas at least 3 treatments over the next 3 weeks, one treatment a week, you'll find that that will come on quite well. We are going to catch up with him next week and follow that treatment with him, and we can see the improvements as it's going over the next 3 weeks. I hope you enjoyed that, and there'll be a lot more coming.